Dame un grr.
¿Un qué?
Un grr.
¿Un qué? ¿Un qué?
Un grr.
¿Un qué?
Un grr.
¿Un qué?
Un grr.
Mi combo de aumento de senos y lipo 360 en Miami me encantó.
Creo que combinar cirugías es una opción más que válida. Ahorramos tiempo, que es muy valioso, la recuperación, ahorramos también en lo que es los masajes. Es como tener, yo digo, un todo incluido. Hola, soy Juliet, pero antes de que te siga contando un poquito más de mi cirugía, haz clic en el enlace de acá abajo y reserva tu consulta gratis ahora. Si yo me volvería a operar, me volvería a operar 100%. Creo fielmente que las cirugías nos aportan muchísimo desde lo emocional, el autoestima, nos hace sentirnos mujeres más seguras, más empoderadas. Entonces sí, a mí mi combo me encantó. Aumento de senos y lipo 360. Haz clic abajo y reserva tu consulta gratis.
¿Qué es una lipotransferencia? La lipotransferencia combina la liposucción con una transferencia segura de grasa a los glúteos. Obtendrás una mejor forma en el abdomen, la cintura, las caderas y los glúteos. Si deseas una consulta gratis conmigo, haz clic en el enlace de abajo.
Dame un grr.
¿Un qué?
Un grr.
¿Un qué? ¿Un qué?
Un grr.
¿Un qué?
Un grr.
¿Un qué?
Un grr.
What makes a BBL look good? It's not about adding fat. It's about creating proportion, a balanced waist to hip ratio, smooth projection, and natural contour. That's what I aim for in every single case.
All right, guys, we are live. Good afternoon to everyone that is currently watching. I have a surprise for you guys, and I know you love having doctors on this live. And for that reason, we have Dr. Sadio over here with us today.
Hi.
How are you, Doc?
Great to see you. Great to see everyone.
How's your day been?
Great. We just did a bunch of cases. We did breast cases. We did BBLs. We did lipo. Just a good day.
A little bit of everything.
Exactly.
It's a rainy day today in Miami, but we had good cases today.
Yes, absolutely.
All right, Doc. So we want to talk a little bit about procedures and just the explanation that I feel like a lot of patients want to hear prior to even booking a procedure, and how the consultation works and why it's so important to have an evaluation with a doctor before booking any type of surgery. So let's start off with that. What's the importance of a consultation and why is it required prior to doing any type of booking?
Yeah. I think that's a great topic, because so often I think we all have an idea. First of all, we are flooded with information right now. There is TikTok, there's social media, everything is out there. And I just think that it's so important to get a customized approach. So what I love about all that, what I love about social media is there's never been a time when patients have been more informed. And that helps me, because the patients come in, they've got their, I want this, I want that. They're so informed. They're asking really sophisticated questions now about post-op, about how we can combine the procedures. But you still need, if you've chosen a doctor, you've chosen them for a reason. That's the other thing. If you've chosen that doctor, chances are you like their work. Chances are you connect with them on some level, right? Mm-hmm. You trust that person. There's some connection there. So find out from that person what they would do to get the results that you saw, that you wanted, because everyone's different. So that consultation is important, number one, because you've chosen a doctor. What do they have to say?
Right.
And number two, customized for you. Customized for you. It's so important. I mean, we always talk about that. Oh yeah, it's customizable just for you. But that's what it's all about. Everyone is different. And you've got to get that consultation, I think, is really important.
It is. And I feel like also a lot of patients come from either other facilities or other doctors. And what I try to explain to them a lot of the time is, listen, every doctor tends to have a different medical criteria. How do you feel about that?
Right. That's important. I mean, we all have different experiences. We all have different skills. We have a different aesthetic point of view, right? So if you go to different artists, they all might work with paint, they understand brushes, but they're going to give you a different a different point of view based on their background and their taste and what they can do for you. Now, yes, can I do the range of procedures, the range of results on I could do, I could do the huge case. I could do a lot of different types of work, but you're coming to me because you vibe with what I do.
Yep.
Right? So let me do my thing, right? And let's talk about how what I do can help you to get what you want.
That's right.
That's so important.
And for my girls that are watching right now, if you guys have any personal questions that you'd like to ask Dr. Sadio, you can just go ahead and leave it in the comment section of the live, and I'll go ahead and read it for you guys, and Dr. Sadio can answer. It's a very fun interaction we're having with patients. They're dropping their BMIs, their weight, we're calculating it, we're seeing if they're a good candidate or not. And for us, it's been a pleasure having you here. I remember when you first came in with us, you and I got to know each other right off the bat, and you were telling us that you were coming from New York and all these type of situations. How has Miami, on a personal level, how has it been for you?
I mean, I love it here. It's so, like, first of all, aesthetics here, it's like going to the Mecca. You know, and that's coming from New York, having been a New Yorker, right? But New York, okay, yeah, there's a lot of plastic surgery and there's a lot of volume, but Miami is like, it's like you are in the hot spot, you're in the zone, and so again, like, just so many patients, so many, the expectations are there, and you gotta come correct. Also, I'll tell you about Miami. In New York, I got patients from all over the country and all over the world, but it's another level here. I mean, this is the destination, and you feel that when you're here, right? It's just in the air. So I'm enjoying it. I'm doing cases. I'm just doing a lot of different cases. Like, I used to be more focused on lipo. Of course, I train in everything, but I was more focused on lipo, more focused on BBLs. I've done all the cases, but I've really been getting into the breasts here.
Yep.
And when we first talked, I said, okay, yeah, I'll do some tummy tucks, but I just love my body contouring. You know, breast cases, sure. But I've really been embracing that and finding that part of my practice again, and just really enjoying it. I love the lifts. I love the augs. I love, getting the measurements. I love finding the right size, getting that, that's kind of, I call it, I'm like the breast whisperer, like trying to get the right size. So that's been a pleasant surprise to get back to my roots and get back to breast work. I'm enjoying it.
And right after we started this live, for everyone that is watching, Dr. Sadio and I were having a little conversation, and because Dr. Sadio has gained so much popularity for breast procedures, because you do a wonderful job on all of your patients, we wanted to talk a little bit to you guys about the importance of choosing the right size of breast implants, or at least the right, if you want saline, or if you want silicone, or if you want a high profile or a moderate profile. So what can you tell us, Doc, about that specific, choosing the perfect implant for each patient?
Yes, absolutely. So I think what's important is when you come in to see, and I think every plastic surgeon would agree with me on this, almost everybody would agree. When you come in and you say, well, what do you want for a result? And you say, well, not too big and not too small. That's just so unhelpful. Because not too big, not too small is in the eye of the beholder, right? Yeah. So it's so important to, I like pictures. I've changed on this over the years. When I first started in practice, I was younger, I wasn't really into like the picture, because you felt like, oh, the person's might be locked into something that might not be realistic. But the pictures are very helpful, because that gets me, you're trying to get into my head, so that when I'm in the case and I'm choosing that size, you're not awake. I'm advocating for you. I'm your agent in the OR, and I gotta get it right. And so that means the picture helps me, even if it's just you want it to be the same, similar body type, etc. But it just gives me a flavor. If I see someone, comes with something very big, or it gives me a flavor, and that's all I need. And then the sizing is fun for me because it's almost like a fitting, it's not your bridal gown, but
I love the process when
Yeah.
we're just fitting the implant into our bra and looking at yourself in the mirror.
Exactly, and it's the preview, and the patients get so excited when they're doing the sizing. So I get excited, and it's just so helpful. Again, what I like to tell patients also is this number. People walk in, I want a 350. You're not sure if you want a 350. You want a look, not a number. Mm-hmm. You want a look, not a number. So that look comes from, the size that we choose and where we go with that. So what we're choosing is not the implant size. We're choosing the sizer size.
Okay.
I'm taking that sizer and putting it in, blowing it up, and then we'll see where the size lands. Oftentimes, different. Might be one is different than the other.
That's a very common situation that I've seen where I actually had a patient once and she got the card and it obviously had like different numbers. So that patient was asking like, oh, hey, like why is my implant size different on one breast rather than the other? And that's exactly the reason why. Can you tell us a little bit more about those specific cases?
Yeah.
And I think I want to also go into detail about breast lifts
Yes.
along with breast augmentation
Yes.
because it's a very
Excellent.
common procedure.
Yeah, excellent question. So the thing about symmetry, so we can talk about symmetry. If you look at you stand in the mirror and you're looking at your two breasts. Well, first of all, I can't leave without giving the aphorism that we always talk about. The breasts are siblings, are sisters. They're not twins, so we always talk about how they're different. Some people are pretty symmetrical, but for the most part, they're probably going to be different. Even if they're the same size, they might be different shapes. And also, a lot of patients don't consider their chest wall, their shoulders. If you might have the breast might be the same, similar size, but the chest wall, the frame is different, and so I need to take that into account. So all of those things are very important, and I would say most of the patients have different sizes. Most of the patients have different sizes, so that's something to understand, and that's why I go out of my way to tell patients we're choosing this 350 sizer. I'm not ordering up 2 350s from the supply closet. We're just choosing a sizer and we're starting there. So that was it. What else? You asked me about the sizer.
The sizer and the importance of a breast lift when you need it
Yes.
to get the perfect result of an augmentation.
Yes.
Because for me as a consultant, for example, since I'm the first person that speaks to the patients, patients tend to come in with something in their mind. Okay, I want my breast to look like this, but then the breasts are a little bit saggy or one is lower than the other one. And then it's hard for patients to understand, specifically most patients that come from out of state, that they don't really have a one-on-one with a doctor during the in-person consultation until they see you the day prior to surgery.
Yeah.
What's the importance of that? Why do patients need a breast lift with augmentation and sometimes not just a simple breast augmentation?
Right, exactly. When you're looking at a wish pick, right? You're looking at your wish pick, and you're seeing somebody with these beautiful breasts, perfect shape, nipples like looking straight ahead. Everyone focuses on the size, and there's not as much of an understanding of the fact that we are moving tissue around with the lift in order to get that look. So how can I explain this? Look at your nipples in the mirror. First of all, are they pointing straight down? Because if you think about it, if those nipples are pointing straight down and then we're putting an implant in, you're just going to have this tissue kind of falling off. That's actually called, in the field, like on our exams, it's called the waterfall effect. So you're just going to have this soft tissue kind of falling off and looking straight down. Like there's nothing about an implant that's going to right the direction of the nipple. So that's number one. Are your nipples like straight down? Number two, how far are those nipples from, what's the distance from this area, this is called the sternal notch, down to where that nipple is? If that's a long distance, again, we're going to put an implant in there, and then your tissue is going to be falling off. It's not going to look good. You'll be so unhappy. And the worst thing you can do is tell a patient who needs a lift to just get an implant, and they're not going to be happy. So trust our judgment on that.
Yep.
That being said, maybe that nipple's a little bit on the low side, but you're going with a larger size implant. The implant itself will give you a couple of centimeters of distance.
Right.
So if it's a short distance, the implant itself is enough. But if it's a long distance up to where it needs to be, you just have to have the lift.
You have to have the lift, correct.
Yeah.
Doc, we have some questions over here in the comment section. They are asking, what's an appropriate BMI for a mommy makeover?
Oh, well, I mean, BMI is so fraught. Yes, BMI 30 is like, that's the standard in the, that's on the exams. But just reach out. And of course, if 40 is we're going to say that 40 is going to be too big for an open procedure, right, which a mommy makeover is. But just talk to us, because maybe your goal can be met with another procedure, or maybe there's a path that involves sequencing of procedures. Come to me with the result you want, not the procedure you want.
Yep.
You see what I'm saying? Because I can take you through the steps and the stages to get you. Maybe that's a one stop and we're done. Maybe it is a mommy makeover. Maybe it is a tummy tuck only. But maybe it's a lipo with a J plasma. Like, let me use my tools. Don't give me one hand tied behind my back. Come, tell me what you want, and then let me offer you a path.
Perfect. Yep, and we were actually talking about that with Dr. JC the other day, and he was explaining how, sometimes to be able to achieve your goal, talking about more of on the results aspect of everything, how sometimes, you got to take a little bit of a longer route with certain layovers and just wait in between until you can finally meet the result that you're going for. So in the sense okay, we can start with this, and then we can move forward with this other procedure, and then finally we can finish with this, and you'll be all set. So how do you like to go about that? Are you that type of doctor that maybe likes to break procedures in between, or you're more comfortable with just maybe combining and just doing it all at once?
It's both. It's efficiency. So I don't want to take there's no reason to delay unnecessarily. There's no reason to do one if you can do two under the same anesthesia, especially if you're traveling. I have had patients from Canada, patients from all the way across the country in Washington State. I had a patient from Italy a couple of months ago. So, it doesn't make sense to say, oh well, to stage for the sake of staging. So we want to stage, but we want to have a mind towards the final excellent result and efficiency.
Sure.
Using your time, your money, and your anesthesia effectively. So that's my take on that.
I know you're very big on combination of breast and lipo 360.
Yes, I love that procedure.
Yeah,
I love that procedure because I love you're working on the entire torso, right? You've got the breast, you've got the waist. To get the breast and the waist in one shot
is amazing.
Is amazing. So I love that procedure, I have to say.
We have a patient over here, Miss Erica. How are you, my love? Thank you for being here with us. She asks, can you do a breast lift with implants and a lipo BBL together? If so, how is recovery being that you can't sit or lay on your BBL?
Yeah, so that's definitely an issue. I do that procedure, yes. Why is it not ideal? Why is Erica asking the question? Because she has identified correctly that you have a procedure on the front, right? So you can't really lie on your belly, you can't lie on your front, and then you've had a BBL, so you can't lie on your back because of the BBL, and especially for patients who have gotten hips, they can't really lie on their side. So you have to really think about how you're going to do that. One of the things I like is the BBL mattresses. So you can at least be on your back.
And then your booty goes into that
exactly hole. And you're in this trough. So that's worth the investment. I mean, we've never been there's just never been a time when everything is available. Like there's so many tools, BBL pillows, mattresses, like everything is available now
Yeah.
for the discerning plastic surgery, Miami plastic surgery patient. So we do have those tools.
It's amazing. And now that we are here, in the next couple of minutes, we are going to be dropping a little surprise for you guys. So if you're on this live, we have some people connected, go ahead and start sharing this to your cousin, to your aunt, to your mother, to anyone you'd like to share this with, because in the next couple of minutes, I will be dropping something that a lot of people do not know. As a matter of fact, I didn't even know myself until a couple of minutes before the live went on. And I do want to go into detail of that, and that will be in the next few minutes. So for now, I'm going to go ahead and continue with the questions that I have on the live. I have someone asking, my breasts fall down and sideways. I'm a triple D and I would like to fix this. I had my oldest daughter as a child at 15, so I never had a chance to see beautiful breasts and body. I was taken advantage of. I am 50 now, and it's time for me to love and feel confident in my body, and I know is underneath this fat and sagginess. How do you feel about that, Doc?
Oh, well, I'm not even looking at it, but I know that look. And we can fix it. I mean, it could be a reduction. Again, I'm not seeing you, but that could be a reduction. It could just be a lift. Maybe you love your size. If you're happy with the way you look in a non-padded bra, chances are you just need a lift, right? Because you're happy with your size. You just need to get everything up to where it should have been. And let me say this about breast surgery and why I've kind of fallen in love with it again. Is if you think about it, like as women, our breasts are just such an expression of our femininity in a way. Yeah. And I just have so many patients about this more than any other procedure tell me, I feel whole. I feel like myself. I feel like the way I was meant to look, so there's something almost reconstructive, about this procedure, and it sounds like for this patient, what's her name?
Well, her username is Coach Lady C.
Okay, for Coach Lady C, it sounds like there's that at play here, which is I never looked like the woman I was, I wanted to be. That expression, that self-expression is so important, and it's a big part of why breast surgery is so special.
Yep. I always like to ask you, doctors, what made you go into plastic surgery? I mean, you have an amazing background as far as your studies and your residency and everything like that, but what got you into plastic surgery itself?
Yeah. Well, it's funny because I was on a rotation, so I was on a plastic surgery rotation. I was, in general surgery, and then I was on a plastic surgery rotation. And, plastic surgery is not just aesthetics, right?
Right.
Burns and grafts and the whole thing. But I was on my aesthetics rotation, and I was, assisting as a resident on a mommy makeover.
Oh, there you go.
On a mommy makeover. And we finished the case, and as a resident you have your duties, and I had to do my follow-ups and my list of patients. I went to go see this patient after her surgery post-op, saw her in recovery. She came up and she threw her arms around me and said, thank you. Because of course, the residents, we meet them before and after we spend a lot of time with the patients. And I just thought to myself, what is it about I had literally done cancer operations at that point, colon cancer, or, taken someone's appendix out, saved people's lives in trauma. And I had never had someone throw their arms around me and say, you got rid of my cancer. You took out my appendix. That was going to kill me. No, but this mommy makeover patient was so grateful and happy. And I'm getting chills about thinking about it now. Like, I was like, I want to feel this way about the work that I do. Yeah. And I want patients to feel good and to feel like their lives are being transformed.
And I think that's the end goal of everything. I saw her username here, Shika. I know you're here. She's a very special patient of ours, and majority of the times, not everyone is super public on, trying to show the results or something like that. But majority of our patients, they're so happy with the results that they want to just publicly just say it out loud. And I think that's kind of like the same experience you had when you had this patient rush into your arms and say thank you for your mommy makeover. I do think I love plastic surgery, and I've been in the industry for 6 years, and all patients tend to be extremely happy, and they tend to come back and bring their mothers and bring their sisters and bring their cousins and their friends. So how do you feel about that, that feeling that patients have right after surgery? How satisfying is that for you as the doctor that performed that surgery?
Yeah, it's extremely satisfying. And there's no greater compliment for me. Like that happened today. I had a patient who said, "You operated on my sister last month," so that, like, to me, that is the ultimate. Like, and I get days where I get the mother and the daughter on the same day, or it's one and then the next. I get the friends from work. I get the cousins. I get all that, and that's special, because then other patients are able to support each other. But yeah, I think again, I'm very. And as I get older, I think more and more about the psychological benefits of what we do. For many patients, this is a kickstart, especially the body contouring patients. So maybe they'll get a lipo or that tummy tuck, but often it's with lipo that just gives them the kickstart. And now they embrace a whole new way of life. They're able to stick with that diet. They find themselves more motivated because they got the first however many pounds off, and they're starting at a higher level, so they're more motivated to stick with it.
That's true.
And I've had patients a year later, they're coming back for some other procedure, and they say, this was the beginning for me of a new way of life, and really being able to stick with my wellness goals.
Yeah, I think that's amazing. And we have someone here. I feel like this comment is very important. Well, Coach Lady C, the person that we answered, she says, "Yes, doctor, that is correct. My feelings exactly. Thank you." Then we have Sherry. She says, "You are helping people come back from social death." And I do feel that way, because talking from my personal experience, I was a very, very big girl. I was 220 pounds, and I was dying to have a lipo BBL. But the results and the expectations that I had weren't going to be achieved at the weight that I was. So I was one of those patients that has had to have it step by step. So now I'm stuck, because now I'm super skinny, and now I can't get a BBL because I don't have enough fat for it.
Oh, you're a problem. I call these like first class problems.
Yeah, and now I'm dying to have it, and I was supposed to have it last year, and I wasn't at the weight requirement, or at least where I needed to be to achieve the results that I want for myself. So now I'm planning on having it done in December, but I'm still stuck on weight. I'm working on it, but there you go. Luz Virginia, te estoy viendo tu comentario, mi corazón. Te mando un beso enorme. Luz Virginia se va a operar mañana con nosotros acá en 305. De verdad que fue un placer conocerte cuando estuviste en tu preoperatorio. Espero que estés súper tranquila, como te lo dije en persona, nada de nervios. Vas a estar súper bien, y el día de mañana te voy a estar visitando y te voy a estar viendo nuevamente para saber cómo seguiste. Te mando un beso, descansa, y por acá nos vemos el día de mañana. For the surprise that we were talking about, awake liposuction and awake BBL.
Yes. So, awake liposuction. It strikes, fear. I shouldn't say that. It's two sides. Some people say they love the idea of awake liposuction because they want to be aware. They want to they want to know what's going on. They're terrified. Some people are just terrified of general anesthesia. Other people say absolutely not. I want to be out. I want to be asleep. I don't want to I don't want to know anything. I just want to wake up and have it be done. So awake lipo. That's a procedure that I've done. I've done a lot of those cases, and there's an art to it. Okay, not everybody can just, pick up a cannula and start doing awake lipo. It requires patience. It requires the right equipment. And it requires, like, the numbing is key. The whole art is in the numbing and getting it and getting that right and being patient and making sure that you get that right. There's a kind of sense among some people that, well, you can't get the results. You can't be as aggressive, and I don't think that's the case. Again, it's just about being patient. I think that when you hear that, it's with somebody who just doesn't want to take the time to do it. So stay tuned, because I miss awake lipo. I used to do a lot of it, and I'd love to see us do more of that here.
I think that's amazing. As far as just a single question, patients with medical conditions, would that be a really good option?
Yes, absolutely. And how many patients do we turn away because they don't qualify for general anesthesia? Or because, that's the perfect option for that patient who just is not a candidate for whatever reason. Now maybe they still might not be a candidate for a weight. It depends on the reason. Mm-hmm. But for the person who can't qualify for the lipo because they can't tolerate, just because of the anesthesia, here's an option for all of those patients. Here's a great option for the higher BMI patients.
Yep.
Those patients get turned away with it. We've got those options. It's just a great procedure, and it's just, you just need to take the time. You need to get the numbing right. Mm-hmm. But I'm really excited about bringing that here.
It's amazing. For my girls watching, I think we're gonna go ahead and wrap this up, but I did want to let each and every one of you know, if you still have not had a consultation, you are able to still get a consult for free with Dr. Sadio, whether it's in person, whether it's virtually, whether it's over the phone with your consultant. Any way you'd like to do your consultations with Dr. Sadio, it is completely for free. She's actually also having an amazing promotion that we've extended. It was our Labor Day special, so it's going to count for all types of procedure, but specifically for lipo 360s, BBLs, and breast augmentations. So for my girls watching, now is the time to do your consult. All you have to do is just send us a private message on DM if you'd like Dr. Sadio to attend your case. If you're one of those girls planning on having your breast done and you specifically want Dr. Sadio, like majority of our patients want Dr. Sadio to do her breast, now is the time to go ahead and move forward with that. My name is Danny. I'm a consultant here at 305, and it's been a pleasure having you here, Dr. Sadio.
Such a pleasure. I love these. I enjoy talking to you. I love connecting with the patients. It's like I got like having our little talk show. I love it. So enjoyed it. Thank you.
Awesome. All right, girls. Bye-bye. We'll see you this afternoon.
Dame un grr.
¿Un qué?
Un grr.
¿Un qué? ¿Un qué?
Un grr.
¿Un qué?
Un grr.
¿Un qué?
Un grr. Dame un grr.
¿Un qué?
Un grr.
¿Un qué? ¿Un qué?
Un grr.
¿Un qué?
Un grr.
¿Un qué?
Un grr.
Mi combo de aumentos de senos y lipo 360 en Miami me encantó.
Creo que combinar cirugías es una opción más que válida. Ahorramos tiempo, que es muy valioso, la recuperación, ahorramos también en lo que es los masajes. Es como tener, yo digo, un todo incluido. Hola, soy Juliet, pero antes de que te siga contando un poquito más de mi cirugía, haz clic en el enlace de acá abajo y reserva tu consulta gratis ahora. Si yo me volvería a operar, me volvería a operar 100%. Creo fielmente que las cirugías nos aportan muchísimo desde lo emocional, el autoestima, nos hace sentirnos mujeres más seguras, más empoderadas. Entonces sí, a mí mi combo me encantó. Aumento de senos y lipo 360. Haz clic abajo y reserva tu consulta gratis.
¿Qué es una lipotransferencia? La lipotransferencia combina la liposucción con una transferencia segura de grasa a los glúteos. Obtendrás una mejor forma en el abdomen, la cintura, las caderas y los glúteos. Si deseas una consulta gratis conmigo, haz clic en el enlace de abajo.
Dame un grr,
¿Un qué?
un grr,
¿Un qué? ¿Un qué?
un grr,
¿Un qué?
un grr,
¿Un qué?
un grr.
What makes a BBL look good? It's not about adding fat. It's about creating proportion, a balanced waist to hip ratio, smooth projection, and natural contour. That's what I aim for in every single case. I start with 360 lipo to sculpt the waist, abdomen, and back, creating definition from every angle. Then I use precise fat grafting to enhance the glutes in a way that fits your body's natural frame. At 305 Plastic Surgery, we don't just focus on the surgery, we focus on the recovery too. You'll get personalized aftercare, compression garments, and guided movement protocols to protect your results long term. If you want a free consultation with me, just click the link below.